Hello and welcome to ashford.com. You are watching an interesting video on mixed results from oral use of colchicine for reducing complications involved in cardiac surgery. Please read this disclaimer carefully. According to a new study conducted by health economists at the University of East Anglia and the Centre for Diet and Activity Research in the UK, walking or cycling to work is better for people's mental health than driving. Researchers find mixed results from oral use of colchicine for reducing complications involved in cardiac surgery, according to a new investigation published in JAMA. Post-pericardiotomy syndrome, the episode of symptoms of pericarditis, including chest pain, postoperative atrial fibrillation, AF, and postoperative pericardial, pleural effusions, excess fluid around the heart and lungs, are all complications that can arise post-cardiac surgery. These complications affect more than 1/3 of patients and, as a result, may be responsible for increased morbidity, extended hospital stay, lead to hospital readmissions and often a need for invasive treatment. In one trial, according to the paper, use of colchicine assisted in the prevention of the above complications. Colchicine is derived from the Meadowsaffron autumn crocus plant. Colchicine is a highly toxic plant hormone that is utilized medically in the treatment of gout. Colchicine is derived from the Meadowsaffron autumn crocus plant, which is plentiful in meadows in Europe and has become naturalized in parts of North America. It is produced in tablets, granules, and ampules of sterile solution. The objective of the study was to determine the effectiveness and safety of using oral colchicine to reduce complications after cardiac surgery. Dr. Massimo Imazio, of Maria Vittoria Hospital, Torino, Italy, and colleagues randomly assigned 360 cardiac surgery patients, enrolled in 11 centers in Italy, to two groups. The patients received either placebo or colchicine starting between 48 and 72 hours before surgery, and continued for 1 month after surgery. Centers were encouraged to use continuous electrocardiographic, ECG, monitoring for at least 5 days after surgery. Patients received follow-up involving physical examination, blood chemistry, ECG, echocardiography aimed at identification and assessment of pericardial effusion, and thoracic ultrasound at 1 day, 3 days, day of discharge after surgery, weekly during the rehabilitation phase, then at 1 month and 3 months. At least one chest X-ray was performed during the hospital stay and then as clinically indicated. Use of colchicine significantly reduced incidence of post-pericardiotomy syndrome. The main outcomes of the study are as follows. Colchicine group post-pericardiotomy occurred in 35 of 180 patients, 19.4%, postoperative AF occurred in 61 of 180 patients, 33.9%, postoperative pericardial, pleural effusions occurred in 103 of 180 patients. 57.2%, adverse event rates occurred in 36 of 180 patients, 20.0%. Placebo group post-pericardiotomy occurred in 53 of 180 patients, 29.4%, postoperative AF occurred in 75 of 180 patients, 41.7%, postoperative pericardial, pleural effusions occurred in 106 of 180 patients, 58.9%, adverse event rates occurred in 21 of 180 patients, 11.7%. The authors write in this multi-center trial, perioperative administration of colchicine significantly reduced the incidence of post-pericardiotomy syndrome after cardiac surgery but did not reduce the risk of postoperative AF and postoperative pericardial, pleural effusions by intention to treat analysis. They add, about 20% of all patients enrolled in the trial discontinued study drug. This relatively high rate may have affected the overall efficacy of the drug, especially for postoperative AF prevention. The study, released early online to coincide with its presentation at the European Society of Cardiology Congress, highlights that adverse event rates occurred primarily due to increased incidence of gastrointestinal intolerance, 14.4% in the colchicine group and 6.7% in the placebo group. No serious adverse events were observed. The high rate of adverse effects is a reason for concern and suggests that colchicine should be considered only in well-selected patients, the researchers conclude. References